Welcome to study section 4, the neck of ANA 212 regional anatomy. The neck joins the head to the trunk and limbs and serves as a major conduit for structures passing through them. In addition, several important organs with unique functions are located within the neck. This skeleton of the neck is formed by the cervical vertebra from C1 to C7, hyoid bone, referred to as the hyoid in common usage, manubrium of the sternum, and the clavicles. In this study section, you will be introduced to the fascia of the neck, deep cervical fascia, and superficial structure of the neck. When you will have studied this study section 4, you should be able to describe the fascia of the neck, you should be able to explain the layers of deep cervical fascia, and lastly, you should be able to highlight the regions of superficial structures of the neck. Let's start with fascia of the neck. Structures in the neck are surrounded by a layer of fatty subcutaneous tissues, that is superficial fascia, and are compartmentalized by layers of deep cervical fascia. The fascial planes determine the direction in which an infection in the neck may spread. This is the diagram of the fascia of the neck. You can study it and read more about the fascia of the neck in your course material. Deep cervical fascia. The deep cervical fascia consists of 3 fascial layers: investing, pretracheal, and prevertebral. This layer supports the viscera, that is the thyroid gland, muscles, vessels, and deep lymph nodes. This fascial layer provides the slipperiness that allows structures in the neck to move and pass over one another without difficulty. For example, when swallowing and turning the head and neck, these fascial layers form natural cleavage planes, allowing separation of tissues during surgery. Superficial structures of neck, specifically cervical region. To allow clear communications regarding the location of structures, injuries, or pathologies, the neck is divided into regions. The 4 major regions are the sternocleidomastoid region, posterior cervical region, lateral cervical region, and anterior cervical region. Let's start with posterior cervical region. The region posterior to the anterior border of the trapezius is the posterior cervical region. The suboccipital region is deep to the superior part of this region. The trapezius is a large, flat triangular muscle that covers the posterolateral aspect of the neck and the thorax. It is superficial muscle of the back, a muscle of the pectoral girdle, and a cervical muscle. The trapezius attaches the pectoral girdle to the cranium and the vertebral column and assists in suspending it. Sternocleidomastoid region. The sternocleidomastoid muscle visibly divides each side of the neck into anterior, lateral cervical triangles. The region between these triangular regions corresponding to the area of this broad strap-like muscle is the sternocleidomastoid region. The sternocleidomastoid muscle has 2 heads: the rounded tendon of the sternal head attaches to the manubrium, and the thick fleshy clavicular head attaches to the superior surface of the medial third of the clavicle. The two heads are separated inferiorly by a space, the lesser supraclavicular fossa. The heads join superiorly as they pass obliquely upward to attach to the mastoid process of the temporal bone and the superior notcher line of the occipital bones. Lateral cervical region. The lateral cervical region, that is posterior triangle of the neck, is banded anteriorly by the posterior border of the sternocleidomastoid muscle, posteriorly by the anterior border of the trapezius, inferiorly by the middle third of the clavicle between the trapezius and the sternocleidomastoid muscle, by an apex where the sternocleidomastoid muscle and trapezius meet on the superior notcher line of the occipital bone, by a roof formed by the investing layer of deep cervical fascia, by a floor formed by muscles covered by the prevertebral layer of deep cervical fascia. The lateral cervical region wraps around the lateral surface of the neck like a spiral and is covered by skin and subcutaneous tissue containing the platysma. Thank you for listening. See you in the next class.